Good afternoon, and thank you all for being here today on Tuesday afternoon. Last week, we had an opportunity to update the people of Mississippi, and I said very clearly that I believe that vaccine distribution was going too slowly and that we were going to address it. Today, I'm happy to come before you and share some of the progress that we've made. We obviously have more work to do, but we are quickly improving. To date, we have done 62,744 vaccinations. That's over the last 4 weeks. You may recall a week ago I said we had done just over 20,000. So we more than doubled total output last week alone. Those were focused primarily on healthcare workers, long-term care residents, and Mississippians over the age of 75. The total number represents about 2% of our total population. Just to put this in perspective, the first 3 weeks we had done a little less than 25,000, approximately 7,500 per week. We did 7,500 shots that were reported yesterday. We doubled the total number of shots last week compared to the 3 previous weeks, and we believe we have a plan that should get us very near doubling yet again in week 5 what we have done in week 4. We now, because of that plan, have the ability to do approximately 30,000 per week through our state-operated drive-through centers alone. That does not include the other 3 avenues of distribution, which include the private clinic distribution plan, the nursing home distribution plan, which is really the federal pharmacy program, which is being run by CVS and Walgreens, and then, of course, those doses that are still standing at our hospitals. We believe that we are headed in the right direction, and I was happy to see that just yesterday we actually, on a per capita basis, exceeded our friends and neighbors in both Alabama and Arkansas within the last week. But we know we're only going to keep improving. It has to continue to get better. That is our mission now. One important announcement that is going to hopefully unlock quite a bit of potential. Starting today, we will be offering the vaccine to anyone who is over the age of 65 and anyone who has a pre-existing condition that makes them more vulnerable to the virus. That's exactly the kind of expansion that we've been pushing for and that we want to see continue. We're working ahead of schedule, but we're never working quickly enough. So, if you're over the age of 65, there are appointments available later this week and into next week. All you must do is call the call center at 1-877-978-6453. If you are more technologically savvy, we would love for you instead to go to the website COVIDvaccine, COVIDvaccine.umc.edu. That is where you can make an appointment online. We know that they're updating the form on the website as we speak. So if it's not already changed, although I believe it is, but if it's not already changed to allow 65 or those with pre-existing conditions, then check back very soon because it will be open sooner rather than later. I also want to point out and just be very clear to our emergency first responders, to our police officers, to our firefighters, and to our teachers, you're on deck. The next time we have an update, I expect that it will be to announce that the vaccine will become available to you. So please stay tuned. And if you are currently in one of those professions and you have a pre-existing condition, or if you're over the age of 65, do not feel the need to wait. Get an appointment today. Before we move on, I do want to roll through some of the metrics that we're tracking For the sake of transparency, so that you can understand what's been happening and where we're going. First of all, as I mentioned earlier, we have 62,744 reported shots in arms as of today. Of those, 57,014 of them are the first dose. 5,730 Mississippians have now received both their first dose and their booster dose, or their second dose, which makes them fully vaccinated. Total number of vaccinations reported by week, as I mentioned earlier, 32,173 in week 4. At this time, we have had approximately 7,500, just slightly shy of that, administered in the last 24 hours. We have had 62,744, as I mentioned earlier, administered to date. If you look at the total number of vaccines that are coming before us, I would anticipate that we will continue to get more and more in the short run. It appears, as we talked a little bit about last week, that the administration is going to go ahead and send us the second doses that they were holding back. And so that's the good news. We should get additional supply of vaccines soon. But I must point out, and I'm going to say this a lot today, it has been made clear that going forward, probably as soon as a week or two from now, it is likely that the federal government is going to start reallocating and redistributing dependent upon one's ability to actually get shots in arms. And by the way, I don't blame them. That's why it is so important that we continue to work to get these vaccines out. We have too many vaccines that have been distributed that are not yet in arms. And for those entities where that is the case, we have and we will continue to reduce the allocation to those who are not fulfilling the mission. Our two biggest vulnerabilities right now with respect to the slow rollout of the vaccines are in our long-term care facilities. That is the federal pharmacy program, as I've mentioned before. And we spent a good bit of time over the last 24 hours talking about what we can do to increase that from the outside or to simply take it over. The second vulnerability is doses standing unused or unreported at our hospitals. They've been given an allocation, and in some instances, they're not using them, and that has to stop. It's why we've largely supplanted them with state-run drive-through clinics. We've just been informed, as I mentioned a few minutes ago, that the federal government is going to start distributing further doses based on how many a state is reporting administered. And if the hospitals will not give us the data on how much they're giving out, it's going to start costing us doses of the vaccine. We need to get this right, and we need to get this right fast. I want to share a few other pieces of news. I signed 2 additional executive orders within the last 24 hours. Number 1, we are going to lower state flags in honor of the United States Capitol Police officers who lost their lives last week. And I've signed another to adjust the unemployment benefits to take advantage of the federal legislation that recently passed to support our small business owners. The 2 adjustments will be that we are going to waive the waiting period for those who lose their job due to COVID, and we're going to ensure that small businesses do not have to pay into the Unemployment Trust Fund for fraudulent claims. I also want to note that our current executive order is set to expire at the end of this week. I would anticipate, and we'll make final confirmation of this as we move towards the end of this week, that we will extend the order in substantial form as it currently exists, and we will do as we have been doing to adjust the counties with respect to the mask mandates based on what the data suggests and where we find ourselves in total numbers. Now, the last 2 days, and I'm going to turn it over to Dr. Dobbs and let him comment on this and other things. We appreciate his work. The last 2 days, we've actually saw a decline in the number of cases that are reported. That's good news. But I also want to be clear. 2 days does not make a trend. And in fact, even if that trend were to continue, I still expect not to see a decline in hospitalizations in the very short run, given that hospitalizations are a lagging indicator. If you look at the last 5 weeks, based upon date of onset of illness, the 2 weeks before Christmas, we had actually seen a downturn. We had rolled over in the total number of cases. The last 2 weeks, or basically the 2 weeks since Christmas, that has actually begun to tick back up. And because of that, I expect our hospitalizations, which have been relatively steady over the last week to 10 days, to remain relatively steady, albeit at very high levels, or increase slightly over the few next coming days. My main priority is to not try to fight this pandemic with stricter and stricter guidelines or stricter and stricter orders. It's to get better and better at distributing the vaccine, recognizing that the virus is still before us, that we as individuals still must make good decisions. We can work to slow the spread of the virus, to minimize and to mitigate, and that is what our focus is. With that, I'm going to turn it over to Dr. Dobbs. Thank you very much for your work.
Thank you very much, Governor. Today we're reporting 1,648 cases, which is a decrease, but again, not clearly a trend. But sadly, we're reporting 98 deaths, the highest number of deaths that we've reported. Sadly, personally, I've lost a couple of friends and colleagues over the past week. And I think for those of you who really look at the old newspapers, I'll actually use the print version when I read the paper every morning. The obituaries are getting longer and longer, and that's likely to continue. As the governor mentioned, hospitalizations and deaths are going to trail no matter what. And in probably about 3 weeks after a case is reported is going to be the risk of death. That seems to drive our hospitalization and death. So we're sad to think that we're going to see a lot more, especially as we're going into an era when we have a highly effective preventive measure. So please, be patient, do the safe things a little bit longer. We're almost, we can see the finish line. I'm not saying we're there. We got a little ways to go until we can get enough folks vaccinated, but we do have a way out of this. So please continue to wear your mask in public, and please avoid non-essential social gatherings. These are the things that are going to keep us safe until we can get a little bit further down the road. We've made phenomenal progress in the past week on our vaccination efforts. Very, very proud to see that. We have seen something that's not encouraging. Only 16% of the vaccine is going to African Americans so far. Last week it was 18% when we brought attention to this, and now it's worse. So we need to do a better job about making sure that we address the concerns about the African American community about getting the vaccine, and also about making sure there's access. And so that's something we're going to spend a lot of effort, and something the governor and I were talking about earlier today. If we look at our partnerships, just for awareness, last week we did give out quite a bit of vaccine to our partners in addition to our drive-through clinics. Last week to private clinics we gave 9,100 doses of vaccine. To community health centers we gave 4,600 doses. To hospitals we gave 30,475 doses. And we had a small amount to pharmacies, which are eligible to be providers through our system. We gave 700 doses of vaccine to be shared with the public, according to the need. We'll continue to have our drive-through locations at Adams, DeSoto, Forest, Harrison, Jackson, Jones, Lafayette, Lauderdale, Lee, LaFleur, Lowndes, Madison, Neshoba, Oktibbeha, Panola, Pike, Rankin, and Washington counties. And I'd like to thank the National Guard and MEMA for their phenomenal help getting these things operational and rapidly successful. The other thing, as far as who is eligible for vaccine right now, as the governor mentioned, people 65 and older are eligible to sign up for vaccine in Mississippi, and those who have chronic medical conditions. And we've had questions about what those conditions might be. And so the conditions that are outlined by CDC are going to be what we've outlined in our scheduler, which is cancer, chronic kidney disease, chronic obstructive pulmonary disease, or COPD, Down syndrome, heart disease, immunocompromised conditions, obesity, pregnancy, sickle cell disease, smoking, diabetes. But also, if your physician thinks that you have other medical conditions that are serious enough to warrant a vaccine because of elevated risk, that also can suffice. So please, if you don't have one of these conditions and you think you might qualify, please get clearance from your physician. And Governor, that's all I have to offer at this time. Thank you.
Thank you, Dr. Dobbs. Appreciate you and your team, as always. At this time, I will turn it over to Colonel Michelle, who's going to give us some updates as well.
Thank you, Governor. Appreciate it. Good afternoon, everyone. I'd just like to start off, just go back over the appointment process real quick. You heard the Governor talk about how you will make appointments on that, so I want to manage expectations a little bit there if I can. Those of you that are calling in the call center are probably finding that your wait times are varying depending on when you call through. The wait times at the very beginning of this were 2 hours and up at times. I know that's very frustrating for those of you calling in. We have added to the call center and modified that and greatly reduced call times. We did have another surge the other day with some call times. We added appointments, but we're working to extend that. 3 ways you can register for your appointments. One of the things is if you can and you have access to go online, please use the online registration process. That is going to be the quickest and the most efficient way for you to do it. If you have an elderly person that falls into the 75-year-old or older category, or the 65-year-old, your parents or your grandparents, please help them, if you will, and get their appointments registered. Otherwise, certainly use the call center. We're going to be expanding that call center over the course of the next few days. That will reduce the abandonment rate on calls. It'll also reduce your wait time. That number for that call center, again, is 1-877-978-6453. And to go back again, the website is covidvaccine.umc.edu. Now, those 2 registration vehicles are only for your drive-through vaccination sites. If you're making an appointment at a hospital or clinic, you'll need to make those directly with them. And you can go to the MEMA website or Mississippi Department of Health's website and get a list of eligible health clinics for getting your vaccinations. So the next thing I'd like to talk about just real quickly is going to move to Zeta real quick. As you know, we got a declaration for Hurricane Zeta, and we did open registration intake centers. They opened today at 8 o'clock this morning. They will be operational from 8 until 6 p.m. Monday through Friday, and then they will be operational on Saturday from 8 until 12 noon. They will be closed on Sunday to reset and operate again. We don't know what the duration of these intake centers will be, but we're going to operate them as long as we need to make it available. Those intake centers are available in George County, Greene County, Hancock County, Harrison County, Stone County, and then Jackson County Board approved theirs today, so theirs will be opening as well. And you can get those exact locations and addresses at the MEMA website at www.msema.org there. Reminder just to make sure the things to bring: Social Security number, contact information that you have, financial information for household income, any damage information to your house, insurance information, and any banking information that we might need to assist there. So, sir, that concludes my update.
Thank you. Appreciate that, Colonel Michelle. One of the things that we talked about last week is, from a logistics standpoint, working with our emergency management team to get a number of state-run clinics up and operational in partnership with the Department of Health, MEMA, and quite frankly, because of the personnel and the dedication of the men and women of the Mississippi National Guard, we were successful in getting those 18 of them operational in general. They open at different days. As I mentioned last week, we doubled the total capacity. We will be up to 30,000 appointments towards the end of this week, and I have instructed them to look for other ways to increase that capacity even further, perhaps even 30 to 50% more over the next 10 days. At this time, I'd like to turn it over to General Boyles. General Boyles has been out and about and thanking his men and women who are performing this, and I'd like to have him talk a little bit about it.
Well, Governor, thank you, and I appreciate the opportunity to say a few words about really the young men and women who are out there doing some really important work for the state of Mississippi. Yesterday, we were in freezing temperatures, and the governor said, let's get after it. And so, we put on the uniform, pulled up our socks, and we were out there giving vaccinations at 12 locations yesterday. I toured around a little bit and saw there were a lot of customers in line. I will tell you that it is a long wait. Please be patient with us. We want to get a vaccination in every arm that we can at these sites. Currently, we're running at about 400, Governor, as you know, 12 sites a day. We have the personnel to cover down on those sites. We also have the personnel to continue doing the testing as requested by the health department. And so we're prepared to react on all those, Governor. I will also say we're working with the governor's office and the governor to expand those sites, to take in more capacity. And I know that the governor will make some decisions along those lines, and we'll be prepared to support whatever he decides. Thank you, Governor.
Thank you. The reality is, I really appreciate the emergency management team, the Department of Health, and their personnel, and the men and women of the Mississippi National Guard. They've stepped up, and the thing that we know about these sites is they're open to anyone as soon as if they meet the criteria, and I know that if we allocate doses to them, they're going to put shots in arms. We're going to get approximately 100% of the allocations, because if we don't have 100%, we're going to stay open until we get 100% every single day. Fortunately, we have an appointment system in place. We have literally tens of thousands of Mississippians that have already gone and made appointments, but we also have appointments available over the next couple of days towards the end of this week, and a lot of appointments available next week. And that's one of the reasons we've opened it up to those 65 and older and those who have vulnerabilities. Again, I want to reiterate, and I'm sure I'll get to do this in the Q&A, if you are one of our very important emergency first responders, if you're a member of the police force, if you're a firefighter, if you are a teacher, you're on deck. We're not there yet, but I said a week ago that we hope to have 75 and older by this week and 65 and older by next week. We're moving fast because we don't want to see any of these doses expire for lack of use. The sooner we can get shots in arms, the more people can be protected, and I'm absolutely committed to make sure we get that done. So with that, again, I want to thank all of these gentlemen for their hard work. They've had to listen to me an awful lot over the last 8 or 9 days, and but they are doing fantastic work. Yes, sir.
You have enlisted basically the National Guard to assist with the inoculations. Are all of your personnel, have they all been inoculated? Does the public have any fear of them, catching anything from them?
Yeah, so that's a good question. So we are receiving vaccinations through the Department of Defense. So we are not competing with the state of Mississippi for the inoculations into our National Guardsmen. We are currently inoculating all our Guardsmen. We are currently under DOD guidelines. It's a voluntary service. I will tell you a good many of our 502F soldiers that are on the front lines are taking the inoculations so they can provide that protection for the customers who are going through the sites.
I will just point out I met with the Secretary of the Army recently, and the fact that that the DOD currently has them as voluntary is relatively unusual in the military world. Typically, vaccinations are not voluntary; they're mandatory. But that's the decision that has been made at this time, and it was made out of the command structure. So, yes, Ross.
Governor, can you tell us why the vaccinations with the long-term care centers, why they're going so slow right now, and how soon will, if you have to make a decision, for the state to take over that?
Yeah, and I'm going to let Dr. Dobbs speak to this as well if he'd like to. The first thing I will tell you is the federal pharmacy program is going too slow in virtually every state. So let me begin with that. The number of trained personnel that is going into our facilities to do the actual inoculations is not adequate to quickly get them distributed. They are adding on people They are doing better. I have met with many of the leaders of the long-term care facilities, and most of them have appointments on the books to get inoculations. And so we are seeing some progress. But what I will tell you is there's a number of reasons for that. One is lack of personnel. Another reason, just to be perfectly honest with you, is and again, this is anecdotal, but if 3 or 4 people are sent to a facility to do the inoculations, what we are finding so I'm hearing, again, anecdotal, I don't have data to prove this, but what I'm hearing is that at most of these facilities, about 80% of the residents, on average, are taking the inoculation. They're getting the shot. But in most of these facilities, approximately a third or less of the employees are choosing to get the shot. And so one of the things that we're looking at is not only how do we increase the speed, but how do we also convince people of the importance and of the efficacy of the vaccine itself. And I certainly want Dr. Dobbs to speak to that, because he has, not only does he have the background to speak to it, he also has the actual experience at this point to speak to it. And so, Dr. Dobbs?
Yeah, thank you, Governor. We're clearly disappointed with the progress in the long-term care project. We had anticipated 3 weeks after activation that every location would have at least one visit, and activation. Well, the first day we got vaccine, on the 15th, we pulled the trigger on activating the plan, and they said it wouldn't be till the 28th until they could activate it. So we had hoped that meant they were going to hit the ground running, and they would have more folks vaccinated. So we've met with them a bunch, and I think the challenges that the governor's mentions have been the challenges they've had. Now going forward, and I know that the Senate Public Health Committee has actually had a couple of hearings on this exact same issue because of the concern. We're going to help, hopefully they can ramp up where they can, but there are a lot of facilities that aren't scheduled to get their first visit until February. The latest one is February 11th, which is a lot longer than we anticipated. There is an option to disenroll by facility, and we can make that vaccine available through another mechanism. Now, what that other mechanism is going to be the question. They can either do it themselves or get a sponsor, or we can do it for them. Those details we're going to work through, but there will be an opportunity to disenroll folks if the CVS-Walgreens partnership can't get to those guys quickly enough.
Yes, sir.
Governor, you mentioned lowering the flags for the Capitol Police officer. Are you still proud of the support that you've received from President Donald Trump? Do you think he should resign?
Well, I believe that the events that transpired at the Capitol last week were disastrous. I don't think anyone can look at those events and say anything otherwise. It was a sad day in our nation's history, and as I not only watched those events unfold, as I spoke to people who at the time who were in Washington, D.C., what I chose to do is to self-reflect and say, what have all of us done, and what have any of us done to raise the political rhetoric to a point at which this transpires? And so when I think about that, it's certainly no doubt that in this country we are as much divided today as at any time, at least in the last 150 years. And that is a problem. And I think all of us would be well served to take a step back, to not only self-reflect on our own actions, but also self-reflect on the actions of others. And let's recognize that in this country, we settle our political disputes by debating on the floor of the House of Representatives, and by debating on the floor of the United States Senate, by debating on the floor of the Mississippi House of Representatives, debating on the floor of the Mississippi Senate. And sometimes we win, sometimes we don't, but the reality is we literally have to recognize that that is the way in which our system works. And I am certainly committed to do everything I can in the future to continue to push towards that, and I think that's something that we must do. Courtney.
Governor, two questions. The first one will bounce off that. The Capitol, we've seen the FBI memo talking about potential protest at all 50 state capitals. If you can comment, or if you've received any kind of warning, or what do you know about that?
Yeah, what I would say to that question, Courtney Ann, is this. In my stance and my position with respect to the potential for protest coming up is the same today as it was back during the summer when we had massive, large protests throughout the state. And it goes kind of like this. Number one, I strongly support anyone's right to peacefully protest. But I want everyone to understand that in Mississippi, we are prepared and we will be prepared. I'm not going to go into any details about the measures that we either have taken or are taking, but I can assure you that I have personally communicated with Commissioner Tyndall, General Boyles, our emergency management team, and whether you see us or not, we are going to protect the integrity of our government buildings in Mississippi. We are here. We will be here. We will be here whenever any of those things occur. Now, having said that, I don't anticipate, much like happened during the summer, we had very large protests. They were by and large peaceful. We didn't see what happened in Mississippi, what happened in a lot of other cities, and I believe the same thing will happen over the next few weeks. But we will be prepared. So, again, I'm not going to go into any operational details with respect to that, but we will be prepared.
On the vaccines, can you talk, you alluded to and I saw that Secretary Azar had referenced that states needed to be prepared for this change to speed things up. It seems as though MEMA has a heightened role compared to when we were talking a week ago. I may be wrong, but can you talk about kind of how anything may have shifted in terms of logistics to make this happen more quickly?
Well, what I would say is this. The first couple of weeks, we were very dependent upon hospitals to distribute the vaccine, and some of them, as is often the case, some of them have done a particularly good job at doing that. The reason we allowed for the hospitals to play such an oversized role initially is because you'll recall in the early phase, it was only healthcare workers. Well, who is best positioned to provide inoculations to their own employees other than the healthcare providers? And so we initially started utilizing the services of the hospitals and trusting that they would actually get shots in arms. As we went over a period of time, it became more and more clear that some were significantly more devoted and dedicated and more successful than others. Just to give you an example, my latest report says we have allocated 104,395 doses to hospitals. Now, last week was a much better week because we started giving doses to other people, but they've only put shots in arms of 48,000 people at this point. So they're well below 50%, and we're in week 5. That's not good enough. That's just not good enough. And what I anticipated happening, because I've been watching the tea leaves and I've been seeing what Secretary Azar is thinking, is that we were going to start getting penalized on weekly allocations if we didn't pick it up. And so that's why we made the decision. We'd always planned to utilize the State Department of Health and their pharmacies and their county health clinics to be one piece of the overall puzzle, but it became more and more clear given the fact that we have, and tell me the exact number, General Boyles, if I'm wrong, but approximately 1,200 guardsmen, all told, under orders for COVID. Now, we've got a lot of them focused on logistics and things such as that at our free testing centers, but we also know that that partnership has worked exceptionally well. And so we took that model and we worked with our emergency management personnel to resource primarily through the use of approximately 60 medics from the Guard who are actually providing inoculations. We are utilizing the services, the same appointment service that we utilized during the testing, which is still open, by the way. We haven't, at this point, significantly reduced those testing opportunities. There may be a time when we do, but in talking with Dr. Dobbs, he doesn't want that time to be right now, so we're working through that. So we're using the appointments and scheduling technology piece and backbone of the University Medical Center because it was there. But the fact is, we got to get shots in arms. As I said last week, there are lots of reasons that we can talk about of why we were behind 8 days ago, but to me, they all sounded like excuses. And we don't have time for excuses. We got to get shots in arms. And so that's the reason we've seen some additional measures put in place. We're still hopeful that our other 3 avenues of distribution, which includes the federal pharmacy program, the private clinic program, and the hospital program, can be part of the solution. But from my perspective, that cannot be the only part of the solution. It's got to be part of the solution. Yes, Ross.
I know you have been a strong supporter of President Trump, but you dodged the question earlier about whether you think the president should resign. And what do you think? Do you think impeachment is the right route to go, given what he's accused of inciting an insurrection last week?
Given what he is, the accusations that have been made against him, I really, from my personal viewpoint, the president was elected to a 4-year term. We are approximately 7.5 days from that term being completed. I personally believe that the rhetoric from Speaker Pelosi and many of her Democrat allies in the House is even more divisive and unnecessary. And while I personally believe that we need to focus on the future, not on the past, and I think when I talk about myself self-reflecting over many months and years of being in political office, I think that there are a lot of those individuals out there that should also be self-reflecting and think about where we are as a country and what role they may have played in getting us here. And there's no doubt that there is a mistrust in some areas with respect to some of the institutions of our country. Some of that mistrust is certainly understood, and so again, I'm not dodging the question. I don't have a vote in the United States House of Representatives. I don't have a vote in the United States Senate. If I did, I believe we're going to have a peaceful transfer of power 7 days from now, and at that point, we need to move on.
Shalina Chatlani from Gulf States Newsroom has a question.
Hi, this is for Governor Reeves or Dr. Dobbs. Governor Reeves, you had mentioned that Secretary Azar might change the model for how vaccines are going to be distributed. How has the state been able to get the number of vaccines it has so far? And how do you think we're going to be able to catch up, giving the second dose of vaccines, if we aren't possibly able to catch up on that number of 40,000?
Well, I will tell you that I have every intention that we're catching up every single day. For example, we averaged approximately 7,000 inoculations the first 3 weeks. On a weekly basis, we averaged 7,000. We did approximately 7,600 yesterday, one day alone. We are headed in the right direction, and we are going to continue to catch up. I have no doubt about that. If in fact the administration does what it appears they're going to do, which is release some of the second doses that they had been holding back, that's going to lead us to continue to work to add capacity at our own facilities. We got to add capacity for a number of reasons, one of which is this is not an issue until the week of Feb 1, but on Feb 1, we've got to be ready to not only provide second doses for some of those who have already gotten the vaccine, but also we want to continue to be providing initial doses. Now, if any of our other partners and our other avenues that we have in place start doing a little better job of getting shots in arms, then we can reevaluate at that time. But as it currently exists, we have every intention of continuing to expand capacity and continuing to expand appointments at our state-run sites. We also plan in the coming days and weeks to try to expand the geographic diversity of those sites. Again, we got to get caught up, and to do that, we have got to be very quick, and we've got to continue down the current mission. We have seen pretty significant geographic diversity in terms of the total number of shots. I've got a chart here that actually has how many shots have been provided in each county, and there's obviously a wide disparity, but there's a wide disparity in the population there as well. So we're continuing to look at that, and we know that we've got to continue to work simultaneously on speed, geographic diversity amongst the individuals that are getting it. And as we open up to more and more categories, I believe, much like what has transpired in terms of the total number of cases, that we will continue to see that those numbers improve.
Nick Juden with Mississippi Free Press has a question.
Hi, yes. Hey, can you hear me?
Sure.
Based on my read of the Senate Public Health Committee, the reason that Walgreens and CVS are so far behind in Mississippi is that they can't find someone to put the shots in arms. My understanding is that a representative from the Mississippi Board of Pharmacy is willing to start bringing in people from out of state, looking for new hires. Why is that process beginning right now? Why is that not something that, I mean, if you take a federal contract to do something like this, wouldn't you try to have the personnel in place, I don't know, when it's time to do it? That's a question for Dr. Dobbs, for Governor Reeves, anyone.
Yeah, so, no, thanks, Dick. Yeah, so we were disappointed that they didn't have folks ready to roll, I'll have to say, and that they're trying to hire right now. I mean, we should have had folks earlier. We're trying to figure out, I mean, there are people who can put shots in the arms. It's just that they want to have their own people who are hired and trained under their own sort of standards to do it. So we're trying to find ways that we can get the vaccine back, or even work with them to have them do the delivery and some of the logistics pieces, and the nurses in the nursing homes can give the vaccines. A lot of it's just red tape stuff that we got to work around. But yeah, no, we agree.
Sarah Pullen with Field Politics has a question. Sarah?
Hey, sorry, can y'all hear me?
Yes.
This is a two-part question, and this is either for the governor or Dr. Dobbs, whoever would like to answer. The first part is, will this new allocation of vaccines for 65 and older, or those with pre-existing conditions, will that extend to caretakers of those individuals?
No, not planned for at this moment for that. I have not seen any indications that it'd be for caregivers for people who are vulnerable.
Yeah, on the second part of that question, we've had a lot of people discussing rumors that the vaccine contributes to infertility or in disabilities for children. Dr. Dobbs, can you speak to any of those rumors or any information that you have from the CDC on those comments?
Well, the enormity of that lie is immediately apparent since no kids have gotten the vaccine, so that's one thing. And only, for pregnant women, we do say just discuss it with your physician, but there's no evidence of harm in the folks that have gotten it, so it's still recommended. It's made up nonsense. It's not real. It's anti-vaccine people trying to cause trouble. So don't believe it. Read science, trust trusted sources, and don't get your science off of Facebook.
Governor, is there any concern, I'm going back through to look at the vaccine phases. So we've started part of 1B.1 and we're starting part of 1B or 1C.1, but some of those other ones you said are still on deck. So should people to some degree ignore that list? Because it seems like it could be confusing if you see first responders and teachers above the 65 and older.
I don't. There's no doubt for the 3 or 4 people, most of whom are in this room, that look at 1.B.1. They may get a little confused. One of the reasons that I'll tell you, the reasons that we are moving as quickly as possible to open up to as many people as possible is because we want to reduce the amount of confusion. We don't want people, because most people want to do right and they want to get in line when they can. But that's the reason we're saying if you're 65 and older, you are eligible. If you have a pre-existing condition, and those terms are defined on the CDC website, but also Dr. Dobbs is more familiar with the specifics there. It's not a definition that we made up. It comes from the website. Then you are eligible. What we know for sure is that the worst outcomes come from those who are 65 and older. Some 80% of total fatalities in Mississippi come from those who are 65 and older. And so that's why we want to get as many people in that category an opportunity to a free vaccine as possible. And so we're hopeful very, very soon, and we're going to monitor literally hourly, maybe more regularly than that, how the appointments process is going. My guess is in the last 45 minutes, there have been a whole lot of people between the ages 65 and 75 who have gone and gotten appointments. Most of our sites were full this week, and many of our expansion plans weren't finalized until Thursday or Friday, and many of the appointments weren't available until Friday, Saturday, and maybe even Sunday. Yet this week, virtually every appointment got very close to being full, and we're gonna inoculate 100% of the allocation that we've done for those.
Is it, I guess, maybe for Dr. Dobbs, especially when we're seeing, I think we're up to 497 deaths for just the month of January. When we have deaths at that rate, how important is it that it is expanded out to those, including those pre-existing conditions?
It's very important. And kind of back to your previous question about the tiers, I think that's less and less relevant. I think the principles and the guidance are now more important than that. And I think that we early on we did try to, from the health department side, we did try to align ourselves with that just as a national standard. But I think as we go through it, the rationale for older folks and vulnerable people makes all the sense in the world. We're going to see a lot more deaths, and it's sad. We need to get folks protected who are most likely to die as quickly as possible.
Nick Juden had a follow-up question.
Hi, thank you so much for that. So the follow-up on what I had was, can we see the schedule for the long-term care facility vaccinations? And the reason I ask, the last I've seen, there's no clinic in the Delta with vaccine access. I've also heard, and I don't know this for sure, which is one of the reasons why I want to see the schedule, is that there are long-term care facilities in the Jackson area that are scheduled for very, very late in the vaccination process. Can we see how that is proceeding and how that might relate to the racial disparity in vaccine access right now?
There are several things layered in there. I'm going to address them kind of globally, and then there are clinics in Washington County and in Lafleur County. There are clinics in those areas that have received doses, including community health centers, although not as many as we might want. So there have been hospital partners. Every hospital's had vaccine across the state. So there are locations. It doesn't mean it's enough. There's a lot that goes with the disparity question that we're investigating. Part of it's going to be access, and part of it's going to be hesitancy. And so we're going to work on both of those, and they have separate solutions, and it's something the governor and I have been talking about a lot, especially on the access piece. And from the equity piece, the health department, it's our role to look at the hesitancy and the communications. And just kind of as an aside, just talking to different folks in the black community, what I've heard over and over again is black folks are waiting to get it from their doctor. I've heard that a lot. And so if that's the case, we need to make sure that folks have it at their doctor if that's how they want to get it. But I do want to say to people in Mississippi that if you have an opportunity to get it at a drive-through and it's relatively convenient, go ahead, because it's not going to be universally available at your doctor necessarily, especially if they didn't sign up to be a provider, right? If your doctor doesn't order it, then they're not going to have it. So please, if you're older and if you're vulnerable and if you're African American also especially, please go ahead and sign up if you can get it.
Dr. Cedric Buckley from WNPR has a question.
Hi. This question, two questions, one for Dr. Reeves and one for Dr. Dobbs. Governor Reeves, now that Mississippi has adopted the revised Operational Warp Speed recommendations of HHS Secretary Azar and CDC Director Redfield, when Mississippi requests its allocation of the new federal financial assistance announced today in order to support personnel and infrastructure to distribute, and administer the vaccine, how long a wait do you anticipate before those funds begin flowing into Mississippi? And how much are you anticipating our state will receive?
Well, thank you for that question. I must admit that based upon the amount of time I've spent over the last year, I feel like I deserve at least an honorary doctorate in public health. But look, I don't know the answer to your question. I don't know exactly the total amount of funds that will flow, nor do I know exactly when we will receive them. Here's what I do know. Lack of access of cash is not a mitigating factor for us at this time. We know how to deal with natural disasters. We know how to deal with the funding of those natural disasters, and most of the time, when you're dealing with Stafford Act reimbursements, you've got to roll with it, and those tend to be funded on the back end. And we're not allowing access to cash as being a mitigating or minimizing factor. In fact, when all is said and done, the vast majority of governor's discretionary funding that was provided in working with our legislative leaders is going to be provided to the Mississippi Emergency Management Agency, and that is the way in which we fund the National Guard. It's the way we will fund a big portion of all of this.
Michael with MPB has a question.
Yes, Governor. Early on throughout the pandemic, we heard a lot during these press conferences, lots of information regarding your meetings with the coronavirus task force, the White House coronavirus task force. When was the last time you had any communication with that task force, and how many times have you had engagement with them since the election?
There was a call today. I was not able to join it because it was originally scheduled for yesterday, at which point I was going to be on the call. Unfortunately, because it was rescheduled for today, I was working on vaccine distribution and had my staff participate in that call. So it was literally at 1 p.m. today, I believe. It could have been 1:30, could have been 12:30 our time. But the latest call with the Vice President has occurred within the last 2 hours.
Caleb with the Daily Journal has a question. Caleb? Okay.
Caleb, are you on?
Can you hear me?
Yes, sir.
Okay. So 2 questions for Dr. Dobbs. I'll ask my first question and then I can ask a follow-up when he's done. So Dr. Dobbs, in the Senate Public Health hearing yesterday, You said that Louisiana and Alabama were vaccinating at a faster rate than Mississippi, and you weren't entirely sure why. Do you have any update about the pace of vaccinations within Mississippi compared to our neighbors? And do you think some of the issues that have been raised today related to staffing and the uptake by staff at long-term care facilities completely explain the lag, or do you still have some unanswered questions?
Yeah, so for anyone who wants to see, CVS has a dashboard, and you can see how many people have gotten it and how many have enrolled. So when I looked yesterday, we had about 100-something enrolled with CVS, and we had 30 that had been seen. Alabama had like 101, and they had 79, so a pretty big difference. And so that's what I was asking about. Everything I'm hearing is it's a workforce issue, that they don't have the folks to give the shots. And that's something that we're going to have to work around. Either they're going to have to get the people, or we'll have to take over that mission. We just got to make sure it works, make sure it happens. And I'd love it for them to find the people and just go ahead and knock it out. That'd make me so happy.
I think Taylor had a follow-up.
Yes, so just quick related question to the issue that was raised earlier, that only about a third of the staff at these long-term care facilities are taking the vaccination. Has the health department considered any action that it or the state might be able to take that would boost the vaccination levels or encourage increased vaccination among staff at these nursing homes?
Yeah, we're going to start trying to understand their hesitancy reasons, the concerns, and try to work through that. We're just getting started into this, so we don't have clear awareness of what all the issues are. But yes, the most of all the people, of all the healthcare workers in the country who need to have a vaccine more than anybody, it's people working in long-term care. So the first thing I want to say is, please, if you work in long-term care, your patient's life depend upon you getting a vaccine. So please, unless unless your doctor says you can't get it, you need to get it. But then on the other side of it is, we need to find a way to do some outreach and see what we can do to increase, because it's not really so much what we've seen. Again, we got to put more data to this. The doctors and the nurses. It's actually a lot of the folks with the aides and the stuff, and we don't understand. Is that sort of a mixture with other hesitancy issues? Is some of it related to hesitancy because of a general lack in the black community who maybe has a little bit more concerns? I mean, there's a lot we have to tease out, to figure out, because as you've also seen, when we had our healthcare, where it was just healthcare, only 18% of the people who got the vaccine were black folks. And that's way lower than their representation within the healthcare community, considering the broad scope of different employees. So anyway, just a lot of work to be done.
Tim Reeves with Vicksburg Post has a question.
Thanks so much. Dr. Dobbs, a couple questions real quick, and I'm sorry if I missed it earlier. When can Vicksburg or Warren County expect to receive the vaccine and or to have sites set up to distribute here? And I didn't see it on the schedules, and it may be coming up, but what can be done or what needs to be done locally to make sure that we are in position to have those sites available? Because I know that currently none of the private locations are located in Warren County, nor any of the sites. I didn't know when that was scheduled.
Well, so there's only 18 counties that have locations right now, right? So every county doesn't have one, unfortunately. Merit Health System and Mission Health have both received vaccine and are providers. And there are other enrolled providers, so we'd like to partner with them more aggressively. Also, our community health center partners. Part of it would be, if you live in the community, ask and see if they're willing to be a provider. We want providers. We want the health folks in your community to do it. And then as we go through this, we're looking at other options for drive-through clinics, and eventually it'll be available in the health department anyway, just like a routine shot. So I've gotten a lot of calls about Warren County today. I know that y'all are in my hearts and thoughts. But the easiest thing to do quickly is to have your enrolled providers order vaccine, and we'll have more midweek, and we'll give them some.
Let me just, again, this is anecdotal, but I mentioned earlier that that we have some facilities that have received significant doses that have done really well, and some that have done less well. I know of in both Harrison and Jackson counties, the hospital down there, Gulfport Memorial and Singing River, have both been engaged in once they received vaccines and once they offered it to their employees, they then partnered in their communities with various entities. For instance, Gulfport Memorial, I saw, sent people, obviously if you look at large hospitals, and the reason we started by giving them large amounts of doses is because they have personnel that have expertise in actually providing shots. Gulfport Memorial and Singing River on the coast, they actually partnered and have been out in the community providing significant amounts of shots. And so if you look at, for instance, in those two counties alone, of the 62,000 that have been provided, almost 9,000, between 8,000 and 9,000 have been in those two counties alone. And so that's one of the things that we need is we need some of those hospital facilities that want to help out in their community. If there is a plan in place to vaccinate in your community where I can be fully confident that you're actually going to put shots in arms if we provide you the allocation, then I'll do everything I can to get you the allocation. I don't want to have 50,000 shots a week throughput at our state-run facilities. But I'm not going to sit and do nothing while shots don't get in arms. And that's the reason we have started at 30,000 per week and are talking about increasing that by 30 to 50% and potentially getting to 50,000. We need, and we should have a goal of pushing somewhere between 60 and 100,000 shots a week. The only way that can happen is if these other programs, our private clinics, our hospitals, and our federal pharmacy programs for our nursing homes start seeing significant upticks in the number of shots that they give. Yes, ma'am.
Senator Dawkins with the gazebo gazette has a question.
Thank you, Bailey. Thank you, Governor. I got two questions. The first one for Dr. Dobbs, the second one for Director Michelle. Dr. Dobbs, where do we stand as far as research that's been done on the COVID variant that has been big in Great Britain and now apparently reaching America and Colorado? The second question for you, Director Michelle, would be, I realize that we have had the money in the releasing for today, actually, for Hurricane Zeta relief. What does that entail? Is it just for municipalities, or is it for businesses, or just give me a little bit more history of that? Anyway, thank you very much.
Yeah, so with the novel variants, we have seen some in the United States. We have the whole time been sending sample submissions to CDC, and we've sent some more this week to see if we have this variant, right? So we haven't seen it yet or haven't been notified with the samples we've sent so far. It's something we're continuing to keep an eye on. If we found a variant in Mississippi, would I be surprised? Absolutely not. It's kind of like with the COVID, it was here long before we thought it was, based on the faulty assumptions that were placed within our surveillance network. The good part of it is evidence does seem that the vaccine works well against it. It's more contagious. And so the same things that work for old COVID work for new COVID, a mask and avoiding social events. So, it's going to be a challenge. Will it get here? Probably. Will it be dominant? Hopefully not. But we just need to be prepared for it. We are doing ongoing surveillance.
Courtney.
Governor, are the private clinics that are listed, I know many of them are hospitals in different areas, are they held to the same phase expectations? I know at least one I've seen vaccinating teachers before those 75 and older, et cetera. Are they still held to expected phases like that?
They're supposed to. I mean, that was the agreement that they would get it so long as they stay within the. I have seen and heard about some of that too, but the one we've heard it, we've tried to reel them back because, and I feel really comfortable with the 65 plus and vulnerable people. I mean, just to be honest, I got a lot of people who would fuss at me. I got a bunch of emails saying, "How dare you give it to healthy young people who are doing work when the older vulnerable people were not?" And that argument is true. I get it. I'm totally comfortable with that, and it's actually what we advocated for when it went into this ACIP guidelines. So I think that this is a lot stronger moral foundation with the 65 plus and the medically ill. So we're going to continue to reinforce that with our partners.
Here's what I would say. I concur with Dr. Dobbs. Of the sins to commit, and I use that term a little bit loosely, let me just say this. I'd rather a shot go in a teacher's arm right now than the 60,000 doses that are on shelves somewhere in hospitals. And so the reason we are going to open it up as quickly as humanly possible, as early next week, maybe even sooner. Remember, I told you on Tuesday that we were going to open it up for 75 and over on Monday or Tuesday of this week. We did it on Wednesday, 24 hours later, because we're monitoring the appointments where we have more visibility and more control and more understanding at our state-run sites. We have the ability to see really what's happening. Now, I will tell you, I am pushing, and these people up here will probably nod their head yes, I am pushing very, very hard. I don't have visibility on data on a daily basis at every single hospital as to how many doses they've gotten and how many they've put in arms. But before any more allocation goes out, I'm going to have that data, because we cannot keep sending doses to places that aren't putting them in arms. And we know that we're less than 50% of the 104,000 doses that are going to hospitals are actually in arms. Again, I want to be clear. There are hospitals that are doing a good job, and so I don't want to throw the baby out with the bathwater. I got a call from a good friend of mine in Alcorn County yesterday. They did exactly that. They went and they took their leftover vaccines that they had given it to everybody in the facility that would take it, and they went and they gave it to 75-year-olds out in the community. That's what should be happening everywhere in the state. And if that were happening everywhere in the state, if they would go to their community center and they would set up appointments for those 65 and older now, or those, then they could get rid of the vaccines that they currently have. They would be in arms, and we'd be ready to distribute more to them. But we cannot distribute unless we have visibility on what is happening, because what I'm telling you is if it's at one of the state facilities, 100% of the allocation on a weekly basis is going to get in arms. Yes, sir.
This question is for Director Michelle. I'm also interested in the funding for Zeta. Where's it going? Individuals, businesses?
Yeah. So, and I appreciate that. And Hunter, as a follow-up, hopefully this will cover your question too. So the funding for Zeta, as you know, we got an individual assistance declaration and a public assistance declaration. In the midst of all that too, you've got small business association declarations as well. So the individual assistance declarations specifically, and I talked about this on the radio this morning, this is what individual assistance will go to and will help. It's going to go to, these are residents of homes in those 6 counties that got declared, and those grants will be for temporary housing, for home repairs, low-cost loans to cover uninsured property losses, and then other programs that will help individuals and owners recover from the effects of disaster. Now, in addition to that, the state has got funds, and all of these counties, if I remember correctly, have their local assistance organizations set up, and they are eligible for disaster grants that will reimburse homeowners for home building materials only. And then we will assist those counties to help with the labor. So that's what's available on the individual assistance and to residents. With regard to businesses of public assistance for the counties that were declared there, then they're going to be eligible, those eligible businesses and nonprofit agencies to assist in work and repair replacement of disaster damaged facilities. So roads, bridges, in the case of the marinas and the wharfs that were damaged, they will be issuing. So there is a deadline of January the 30th for public assistance for them to get their project work statements in. The governor's already signed the federal-state agreement allowing those funds to be released as soon as those work agreements are approved. And then on for individual assistance, they have until March the 1st to put their applications in.
Yes.
Keisha Rowe with the Clearing Ledger has a question.
Hi, everybody. I have a couple of questions for Dr. Dobbs. My first question is, logistics have been a problem as far as storing vaccines in the state. If Secretary Azar or the next administration that comes in does release these extra doses to the states, do we have the capacity to store it all? And then my second question is how expansive will the mobile testing unit and other programs to serve underserved areas be? Because I know that you mentioned before that that's something that you guys want to try to look into to help reach more people in the state.
The storage issue is not really an issue. For the Moderna, we order it directly and it goes straight to the site, and they use it. They should be able to use it immediately. So it's not like there's a central storage requirement. For the Pfizer, it's a little bit more challenging. To locations that can absorb 1,000 doses at a time, it's really easy. You can actually have like 5 to 10 days to process it. So it's really more of a logistics, not of the storage, but of the getting it into people. And so that's where we got to make sure folks are able to do that. We also do have the capacity to store hundreds of thousands of doses within Mississippi at some of our select sites, so that's not really a challenge from that perspective. As far as the disparities question, we're looking at that. We want to have access, but we also want to make it where folks are going to use it. We know that our community health centers are going to be great partners. I'll tell you, Jackson Hines has been fantastic. They've absorbed as much as we could get. They called yesterday for 200 doses. Well, they asked for more. I scrounged up 200 doses, and they used it all within half the day. So those are the sort of partnerships that we need. And we're going to find those. It's going to be sort of like vaccine survival of the fittest. The people who can do it well and make it work, we'll work with those guys. And that same thing's going to apply to communities that are face disparities. We want to make sure we reach that, whether it's going to be a drive-through or a task force, sort of like a team, or it's going to be a partner.
Yes, sir.
I noticed, I've been to 2 nursing homes recently, Mississippi State Veterans Nursing Home and a facility today in Jackson. Both had representatives of CVS at one and Walgreens at the other. And I noticed that as it took time for them to actually give the Pfizer vaccine, even though it's prepared ahead of time, it has a short shelf life, once it's activated. And as such, they try to get it out. But the staff is also in a teaching situation in that any reluctance upon staff at these nursing facilities, they taught or were answering their questions or taking the time to do this. Is this one of the reasons why it's taking so long to get it out there, that they're having to do this individually at every facility, even though the information that y'all provided is general, it's out there? But is this the situation that's being called for?
That shouldn't be a major impediment. Through the drive-thrus, we have personalized nursing education Q&A, everybody who goes through the line. So it's part of the process. I'll tell you, we've done some events like in my office for just to get, prominent leaders for, get people going. My team of 2 folks can do 20 people in under an hour, no problem. 20 people in under an hour. The average nursing home is 60 people. So those are things that should be doable. And that was with Pfizer and Moderna. So there should be ways to do it.
We're going to have to cut this off here shortly, but one thing I want to definitely get in, and I know there's at least one person that hadn't had an opportunity to do a question. I'm gonna turn it to Alex in just a second. But one thing I want to definitely say is I am being alerted that there is an overabundance of calls to the call center and web traffic of people trying to get appointments. I know it's frustrating, but that's actually a good thing. That's saying that there are literally tens of thousands of people across Mississippi that are excited about getting a vaccine. So we're going to do everything we can to get these calls answered. You may want to wait an hour. You may want to wait 2 hours, but we're going to do everything we can to get these calls answered and to get the website back operational and functional. As a reminder, there are 60,000 doses that have been sent to hospitals, and many of them are offering. And so just if you're in a rural area and the current state sites are a ways off, the hospitals may be and should be an alternative. Alex has had a question for a long time. So.
Alex?
Oh, hi. Potentially, if the federal government does kind of take control of the kind of reallocation of the vaccines, what are some of the pros and cons for Mississippi if that happens?
Well, if the federal government decides to penalize states for being slow to get the vaccine out, I would not anticipate them doing it for a couple of weeks. And at the current pace that we are on, we're going to continue to move up the charts, and we're going to do everything we can to get the vaccines that have currently been distributed to us in arms so that that's not an issue. One more, I think. Bracy was.
Yeah, from NBC.
Hi, good afternoon. This question is for Dr. Dobbs. Apologies if I missed you sharing this earlier, but there was some data that you recently shared with the Senate Public Health and Welfare Committee. I just wanted to make sure that I interpret it right. Can you go over again, out of the 89,700 doses for Mississippi that are allocated through the federal pharmacy partnership, how much of that has been administered at this point thus far?
Sure. I should have it here. Forgive my.
In the prior 24 hours, 835. Overall, it's 4,106. And that is today's report. Again, we appreciate, we've been doing this for an hour and 20 plus minutes. We will do it again soon. Again, know that we are working hard. For those of you out there that are trying to get an appointment, we're continuing to add appointments. We're continuing to build out the program. Please be patient. I know I'm so excited that so many of you are interested. That's a good thing. It gives us reason for optimism. And we're going to get through this working together. So thank you all, and God bless.